There are signs the Omicron COVID wave that's run amok during summer is fading. But what will happen in winter? Will we soon need a booster to be fully vaccinated? And when are we going to finally sort out aged care vaccinations? I spoke with Queensland Chief Health Officer Dr John Gerard a short time ago. Dr Gerard, thank you very much for your time. There's lots to talk to you about, but let's start with aged care. I think before the border reopened, Queensland was probably one of the safest places in the country to be in aged care during this pandemic. And now you have said that more than half of your deaths are there. With the beauty of hindsight, which I guess we all have, is there anything that you could have or would have or should have done differently to prevent that?
Look, Tracy, by and large, the response after the opening of the border has gone well. The one disappointment, of course, is the problem with the elderly, and specifically the slowness in rolling out boosters for the elderly. What we have discovered since the opening of the borders is that the boosters for the particularly for the older population, are critical in preventing serious disease and death. And it would have been good if we could have got those boosters out faster across the board. So if there's one shadow that overlies the opening of the borders, that would be it.
If you'd known that the aged care population was so unboosted, would you have delayed opening the border?
I don't think it would have been a question of delaying opening the border. It would have been a matter of pushing harder to get those boosters into the older population, particularly in aged care.
Is it the fault of the facility that their residents were not, and their staff were not boosted, or is it the fault of the federal government for not getting the jabs out there, rolled out there? Whose fault is it? Who dropped the ball?
Look, I don't think it's helpful to look for who's at fault. I think it's a question of looking for solutions, and certainly Queensland Health is looking to assist as best we can with the Commonwealth effort to roll out the vaccination. Of course, as we know, aged care facilities are the responsibility of the Commonwealth Government, but we are doing what we can, and we are offering what assistance we can to the Commonwealth to improve that rollout.
You've been a career clinician until your latest job. Does it frustrate you that 2 years into this pandemic, we are still letting down the very people whom we knew at the start were the most vulnerable, and that was our elderly?
It is a disappointment that so many of the older age group have not received those boosters, although 70% of those that are 70 and older have received those boosters and they have been protected. But this virus does seem to be finding that group that has not received that third dose.
On that issue of third doses, we're told there's this pretty good, rumour going on that ATAGI is on the verge of new advice that might redefine what fully vaccinated means in Australia, and that indeed you'll have to have had 3 shots to be considered fully vaccinated. Would you welcome that advice? Would that go along with what you believe should happen?
The main thing is that older people in particular get access to that third dose. I will just await the advice of ATAGI. I'm not going to express an opinion one way or the other about mandating a third dose. The main thing is that people who want to get that third dose have access to that third dose. What we do know about this particular group of people, the older age group, they've received 2 doses of the vaccine, so that implies that they're not vaccine deniers, they're not vaccine hesitant. They want to get vaccinated, but for whatever reason, they haven't been able to gain access to that vaccine in some cases.
Of course, fully vaccinated doesn't just apply to elderly people, and given that international borders are about to open and Victoria is indicating that it might well apply the 3 doses to international travellers who want to come to Victoria, would you advise that Queensland require international tourists to quarantine if they're not boosted if ATAGI changes its advice?
We will follow the advice of ATAGI. Whatever ATAGI advises, that's what we will follow.
I guess the reason that I'm asking you this question is because the Prime Minister has said that double vaccinated will be a requirement for international tourists coming into Australia. If ATAGI changes the advice that to be fully vaccinated you have to have 3 shots. Victoria is indicating that that will probably apply to international tourists. So it would seem that there would be a state-based decision involved there in terms of whether international tourists can come in without quarantining. And I'm curious to know what your input would be to that decision.
I would like to hope that any decision that pertains to immigration and visas, etc., is made at the Commonwealth level rather than the state level. I think that would be a better way to go.
Okay, so if the federal government says, right, ATAGI says to be fully vaccinated you have to have 3 shots, but that's okay, international tourists can get in with only 2 shots, you'd say that's fine, they can come to Queensland?
I think it won't happen like that. Let's see what the advice is when it arrives.
Would you advise that there should be caps on international tourists coming into Queensland?
No, I wouldn't. I'd like the caps obviously on the unvaccinated, but for vaccinated travellers, no, not at all. I mean, the virus is now widespread in Queensland. We have very large numbers of people infected here, and despite the very large numbers of people infected with the virus in Queensland, the impact on our hospitals has been far less than we expected. We did a survey on the Gold Coast, for example, which showed that just 1 in 10 of people who were positive when we tested them at random already knew that they were positive. Now, we know that in Queensland we have already formally identified 350,000 positive cases of COVID-19 in our population. But in reality, the number is far greater than that, much greater than that. There's likely to be at least 1 or 2 million Queenslanders that have been infected with this virus since the beginning of the Omicron wave around New Year when it started. So I think the relatively small number of international travellers would have a very small public health impact on that.
New South Wales is looking at winding back most restrictions at the end of the month, like mask wearing indoors. Are you tempted by those sorts of ideas?
We will look at the situation as this wave ends. So we are now past the peak of our wave and the number of cases is falling rapidly. Clearly this wave is going to end in Queensland at some stage, probably by the end of February. And at the end of February we'll start looking again at what our restrictions are.
So you think you'd stick with masks?
I think we'll look once. It all hinges on what happens next. In fact, Australia is going to be one of the first countries to enter the winter after this Omicron wave, and so we don't really know what's going to happen. The good news is that we have quite a significant wall of immunity that has developed here in Queensland, both through vaccination, including boosters, and wide-scale infection. Most of the infections that we've seen have actually been in people who have been vaccinated, but as a result, the infections that we've seen have been, for the most part, very, very mild.
And you indicated, I think, a couple of weeks ago that you were worried about the flu being a bit of a double whammy this winter with COVID, because we effectively really haven't had the flu for the last 2 years, and international travellers will be coming back in. What impact is that going to have?
Well, a lot of us have lost our immunity to the flu because we know that our immunity wanes over time, and if we do have a flu epidemic this winter, a seasonal epidemic this winter, it could well cause, as you say, a double whammy of infection with a secondary Omicron wave and an influenza wave. But that's speculation. We haven't seen much influenza activity yet, and we don't know whether there'll be an Omicron wave, but certainly that's something we are preparing for. And I would strongly advise people to get influenza vaccine this season.
Yeah, exactly. So, okay, get your flu shot, but what else should we be doing to prepare for winter? I guess we'll have a couple of months of lull as this wave diminishes and a winter wave builds up. What do we need to do?
Well, what we always do, that is good hand hygiene, cough etiquette, etc. If you're sick, for goodness sake, don't go to work, don't go to school. Those are the critical matters. And it's not just flu. There are other respiratory viruses that occur in the winter as well. I know in the Northern Hemisphere they had outbreaks of the respiratory syncytial virus this year, which we hadn't had for a couple of years, all because we've sort of been cloistering ourselves away for the past couple of years. So it may well be that there are other viruses that we see this coming winter, but we have to do it. We have to move on. And we just have to be prepared that this is likely to happen this winter.
Will schools cope? Because schools, as we know, have lots of people crammed into rooms, and in winter the windows are closed. Are you prepared for that in schools? And might you have to, I know that you haven't done what other states have done, which is routinely test kids. Might you have to look at doing that?
No, the issue of doing the test to stay, the rat testing before going to school is not, it's controversial. There's not a consistent belief among all epidemiologists that this is the way to go. There are problems with it, with doing that. Essentially you're testing perfectly well children. If you get a positive result, you're then obliged to isolate that child and quarantine the entire family. Our preference is to test the sick rather than to test the well.
2 years in and we're still learning. Thank you very much for your time.
Thank you very much, Tracy.
Dr. John Gerard.